are concerns the federal government's undersupply of RAT tests is compromising the health of pharmacy workers and the general public. Joining us live now is President of the Pharmacy Guild Australia, Trent and Twomey. Trent, thanks so much for your time. Are pharmacy workers at risk due to the lack of RAT tests?
So personal protective equipment for our healthcare workers has been a constant gripe for many, many months. So we were seeing promises from the primary health networks to provide protective personal equipment to our vaccinating pharmacists before Christmas. Some of the PHNs have started rolling out that now. Most of them have not. My pharmacies in Far North Queensland only received the form to order the personal protective equipment over the weekend. So I've now placed those orders, but not one of my pharmacies have received them. So listen, community pharmacy networks are just as critical as the general practice network and just as critical as our hospitals. We need to make sure we have not only enough masks, but also enough eye protection. Under the infectious disease guidelines, healthcare professionals have to make sure they cover their eyes, not just their respiratory inlets of their mouth and their nose. And at the moment, there's a lack of that coming through.
It's incredibly important. How are pharmacists holding up? They must be exhausted.
You know, we are exhausted. My wife and I are both pharmacy owners in Cairns and Far North Queensland. We've been in our pharmacies every single day of this pandemic. I was doing media calls before the kids unwrapped their Santa presents on Christmas Day, and after, before they got to ride their bike, but after they got to see it, they were down in the pharmacy with us and we were doing data entry. And, that's just a normal story. That's nothing out of the ordinary at the moment. So not only did we administer more COVID-19 vaccines over the 2-week festive season than any of the other access points, whether it be general practice or mass vaccination hubs, now we're going to be providing these rapid antigen tests in the coming weeks. And, it is a very big burden, but that's why we're here. We're not complaining. We're just asking for a bit of patience when you front up with, the girl or the guy on the back counter.
And what are some of your concerns with the Prime Minister's plan to distribute these RAT tests to concession card holders and not chemists?
So listen, that's how the normal supply chain works. So when you receive your medicines, when you get a script from your doctor, you present to the pharmacy. The pharmacy doesn't receive that free stock from the Commonwealth and it just sits there. So the manufacturer charges the wholesaler charges the pharmacy, and after that occasion of service happens, after that medicine is supplied, the pharmacy then claims the money back from the Commonwealth. So that's normal. It's never been discussed either by myself with the Prime Minister or with any of my state or territory pharmacy presidents with their premiers that we were ever going to receive free stock. The issue is we just need the final details on that program signed off, and that goes to National Cabinet this Thursday. So we've sorted the details with the feds after last week's announcement. The premiers need to sign off on it with haste this week, and then the sector will place all of those orders and they will be air freighted in from every country we can get our hands on them, and they'll be available as soon as we possibly can through the network.
So there's a lack of supply when it comes to rapid antigen tests, or that it's almost impossible to get your hands on one at chemists and pharmacies. There's also panic buying now with Panadol and Nurofen. Is that causing extra stress?
Yeah, of course it is. So, we've got the vaccinations, we've got the testing, and we've got the treatment. And they have always been the 3 pillars of our nation's response to the COVID pandemic. And whenever we start a new phase, either in vaccinations, either in testing or in treatment, stock supply is patchy. And we're seeing that this week with the new phase of the vaccination with childhood vaccines. We've been seeing that for 2 weeks with the transition from PCR to rapid antigen. And now we're seeing it in those treatments that are needed for self-care of the virus, because 80% of us will have mild cases and we won't need any further assistance or treatment from the medical profession or our hospitals, but we'll need to stay hydrated with electrolyte replacement. We'll need to control temperatures and fevers with paracetamol and ibuprofen. And it's those particular things, thermometers as well to monitor our temperature. And it's all of those 3 things in all of those 3 different categories that whenever we get an acceleration, we get patchy outages. And, the system's doing its best to keep up with demand.
Are you concerned that we're going to see this more this year?
Listen, this is an anomaly. So our country has been absolute phenomenal outlier in terms of managing this pandemic. And, we are very, very critical of our state and territory governments and very, very critical of our Commonwealth. But let's just have a bit of a reality check. We've got less deaths per capita than any other developed country. Our booster program is ahead of most of the other developed world as well. But we were executing what we called a suppression strategy, right, for the past 2 years. And all that did was delay the inevitable. Now, it is inevitable that we will all contract COVID. In fact, we'll probably all get it before the end of February. The reason we were suppressing and delaying was so we could vaccinate, so we could minimise serious illness and death. But now that we have one of the highest vaccination rates in the world, and we've started to release restrictions and people are moving around, we're playing catch up. So this is why we're seeing the Omicron virus spread so quickly, so fast, because we haven't had the number of cases that the rest of the world had. And you can't skip this phase of the pandemic. You have to go through it. I know, and I've been at certain times exceptionally critical of the premiers, the chief ministers, and the federal government. But you know what? This is a stage that we have to go through. We will go through it over the next 6 weeks. It will be bumpy. We won't get it right. But I think we all need to just take a step back, a deep breath, and have a look how we're going compared to our international peers. And you know what? We're doing pretty bloody well.
Trent, Twomey, we have to leave it there. Thanks so much for your time.
Thanks. Have a great day.